Hi, I'm Alfred from Warunga Family Dental Centre, and today what we're going to talk about is root canal therapy. Why it may be needed, and what happens there, and what happens to your tooth afterwards. To answer the question of why a tooth may need root canal treatment, the first thing we need to know is what's in a tooth. So if we look here at a healthy tooth, on the outside you have the white enamel of the tooth. Inside there is the dentine, which is the yellow part of the tooth, and then deep inside the tooth is the pulp chamber, where there are blood vessels, nerves, and some other sort of tissues that nourish the inside of your tooth. Now, what can happen is, if a tooth ends up with decay that's left untreated, the decay will pass through the enamel, into the dentine, and then into the dental pulp itself. When that happens, you get an infection that can track down the root canal system here and then cause a dental abscess. When this happens, the tooth can become hypersensitive to hot and cold, or may even become sore to bite on, or may end up being very sore all the time. In that situation, the tooth needs a root canal treatment, or alternatively, the tooth may need to be removed. A common question we get asked when we start talking about root canal therapy is, can you take antibiotics to fix the problem? The answer is no. When we take antibiotics, the antibiotics can get around the bony area here, but because there's no circulation inside the tooth, the antibiotics don't penetrate deep inside the tooth to eliminate the bacteria that are inside there. So what inevitably happens is the bacteria retract down those root canals, and then the problem returns. So that's why antibiotics can't fix the problem. What happens in the root canal treatment? What we do in the root canal treatment is to clean out all of this infected tissue inside your tooth. The process involves us making an opening into the tooth so we can access the inside of the tooth, and then using some special instruments, we can then clean out all of these canals, flush it with disinfectant, and then put dressings in so that the infections can clear out. Once the infection's cleared out, the inside of the tooth is caulked up to make it more difficult for bacteria to reinfect the area. How successful is root canal treatment? For a tooth that is in reasonably good condition, the studies have shown there's about an 86 to 94% chance of success. However, there are some complications that can happen along the way. When a root canal treatment is done, we need to get our instruments all the way down to the tip of the roots. Sometimes the damage has been so bad on the tooth that the canals become narrow and we may not be able to get all the way down to the bottom. Because we use fine instruments in these root canal treatments, occasionally the tip of an instrument may separate. If an instrument separates depending on the stage of treatment, it may or may not affect the outcome. Generally speaking, when a tooth needs root canal treatment, it's usually already had a lot of damage to the top of the tooth, so it is at high risk of fracture. The tooth may fracture during or after treatment because it's been so weakened. When a tooth has had root canal therapy, generally speaking, we will want to reinforce the remains of the tooth properly at the end with either a crown or an onlay. The other thing that may happen is a cyst may form as a result of the previous infection around the root canal treated tooth. These problems with root canal treatments happen infrequently. Generally speaking, if the treatment is done promptly, they're easily overcome. But please feel free to ask us if you're concerned or would like further information.